Welcome to Nursing Prep. Push yourself in nursing preparation with smart way. Anti-inflammatory and anti-neoplastic drugs. Anti-rheumatics are used to. Option A. Directly affect the inflammatory response. Option B. Encourage excretion of autoantibodies. Option C. Retard progression of joint deterioration. Option D. Mediate the action of NSAIDs. Right answer is Option C. Retard progression of joint deterioration. These drugs cannot stop the disease itself but are believed to retard or prevent the process of joint deterioration. For choice A, the inflammatory process is affected indirectly. Autoantibodies are not excreted. Disease-modifying anti-rheumatic drugs are used in combination with NSAIDs but do not mediate their effect. Gold compounds are contraindicated in clients with Option A. Liver dysfunction. Option B. Cardiac disease. Option C. Pre-existing dermatitis. Option D. Rheumatoid arthritis. Right answer is Option A. Liver dysfunction. An adverse reaction to gold compounds is liver toxicity. Therefore, use care in clients with pre-existing liver dysfunction. Which of the following agents can be used in treatment of rheumatoid arthritis, Sjogren's syndrome, and SLE? Option A. Auranofin, Ridora. Option B. Allopurinol, Xyloprim. Option C. Sulfasalazine, Azulfidine. Option D. Chloroquine, Aralane. Right answer is Option D. Chloroquine, Aralane. Chloroquine has had documented success in the treatment of rheumatoid arthritis, Sjogren's syndrome, and SLE. Auranofin and sulfasalazine are used in the treatment of rheumatoid arthritis, but none are used in the treatment of all three syndromes. Frequent eye examinations are recommended in clients receiving Option A. Chloroquine. Option B. Colchicine. Option C. Penicillamine. Option D. Gold compounds. Right answer is Option A. Chloroquine. Corneal deposits are an adverse reaction associated with chloroquine administration, necessitating frequent eye examination. Nurse PI is instructing a client receiving probenecid, Benemid. She should cover all of the following information except the need to. Option A. Change dietary habits. Option B. Increase fluid intake. Option C. Have frequent laboratory work done. Option D. Recognize side effects. Right answer is Option C. Have frequent laboratory work done. Side effects of probenecid treatment are relatively benign, and there is no indication that there is a need for frequent laboratory evaluation. Enrique, who is under chemotherapy, has the following CBC results: WBC 5000/3, RBC platelet 10,000/3. Which of the following is he at risk for? Option A. Infection. Option B. Bleeding. Option C. Angina. Option D. None of the above. Right answer is Option B. Bleeding. A platelet count of 10,000/3 means that the client does not have enough platelets to clot the blood. Therefore, the possibility of bleeding is high. Choice A is a normal value of WBC. Angina would only be a risk if the client had a lower RBC count. Lorraine, who is on chemotherapy, has a history of cardiac disease. The client is at risk for cardiac complications because Option A. White blood cells are reduced. Option B. Oxygen carrying capacity may be reduced. Option C. Sodium levels may rise, meaning fluid overload. Option D. Hematocrit is lowered. Right answer is Option B. Oxygen carrying capacity may be reduced. If hemoglobin and red cell counts drop from myelosuppression, the oxygen carrying capacity will fall, leaving the person at risk for angina. Which of the following is the priority nursing diagnosis for a client undergoing chemotherapy? Option A. Decreased cardiac output. Option B. Fear. Option C. Altered nutrition. Option D. Anxiety. Right answer is Option A. Decreased cardiac output. Decreased cardiac output is more important than the other choices because it can jeopardize the client's life. Which of the following contributes most to the debilitation of an individual during a course of chemotherapy? Option A. Diarrhea. Option B. Alopecia. Option C. Constipation. Option D. Pain. Right answer is Option A. Diarrhea. Diarrhea will cause debilitation as fluid and nutrients are lost at a time when the body most needs to be nourished. Combination chemotherapy is used in the treatment of cancer because Option A. Single-agent therapy produces cell lines that are resistant. Option B. Two drugs are more likely to work. Option C. Single-agent therapy requires larger doses for long remissions. Option D. Two cancers may be present. Right answer is Option A. Single-agent therapy produces cell lines that are resistant. Single-agent therapy tends to produce resistant tumor cells, making remission or cure impossible. Thanks for watching. If you have any doubt, ask in comment section, and you like our video, then do like, comment, share. Subscribe our channel for regular updates.